Yeah, so at ASH meeting 2024, I had the chance to present the results of the part one of this study that combined mezigdomide and dexamethasone with one of three other oral agents in the treatment of relapsed refractory myeloma. So the foundation of this project relies on the fact that we know there's some pro-oncogenic pathways in myeloma that are relevant, are implicated in disease behavior, shorter overall survival, and most importantly, resistant to drug therapy, including resistance to IMiDs, and are amenable to interference with existing or drugs in development. So that includes the EZH2 pathway with Tazemetostat, the BET inhibitor, the BET pathway with the BET inhibitor that we call 158 for short, and the MAP kinase pathway where we can interfere with MEK inhibitor. In each one of those agents have shown at least an additive effect to mezigdomide and dexamethasone when combined in vitro in preclinical models. So this was a dose-finding study for MEZIdex in a combination with one of those agents. This was a very heavily pretreated patient population. We had 56 patients with 16, 20, 20 in each cohort. People have had a median of 5 prior lines of therapy. The majority of patients, 57%, had had a prior T-cell redirecting therapy, either CAR T-cell or a bispecific T-cell engager, to which the disease had become refractory, as was the case in 28% of the patients. A lot of patients had extramedullary disease, so a very tough cohort to treat. Despite that, we saw good tolerance. All the dose levels tested on both on the Tazemetostat and the Trametinib, the MEK inhibitor cohorts, were found to be safe. With 158, the BET inhibitor, the highest dose was not safe because excessive thrombocytopenia, but the other doses were. And we saw some incredible activity, particularly with Tazemetostat and Trametinib. We saw responses in 50% of the patients on the first cohort and 35% on the BET inhibitor cohort, but 75% of the patients in the MEK inhibitor cohort with toxicity profile that's very similar to MEZIdex alone. So that indicates that, a potential for using mezigdomide is very potent, novel cereblon modulator in combination with other already existing oral agents in a way to overcome possible intrinsic drug resistance and really provide a stretch of progression-free survival for those patients who have very few other options otherwise. So this program is going forward to refine those populations and refine those use of those agents, perhaps in less heavily pretreated patients.